be here to be speaking with you today. And as Amanda mentioned, I'll be talking about implementation outcomes and focusing on what they are, why they're important, and how they're measured. And what I wanted to first just start with is just to introduce them in a broad conceptual model for implementation research. So I think with a lot of health services and public health studies, we're really focusing on examining interventions or health services and how they may be impacting patient outcomes. And for implementation studies, we're really interested in the how. So we want to focus on implementation strategies and how we get those interventions or evidence-based practices into use. And as part of this, in terms of supporting the implementation, there are specific sets of outcomes that we focus on. And so these outcomes usually precede our patient outcomes. So if an evidence-based intervention or intervention is well implemented, then we would expect it to prove the implementation outcomes. And then we would expect for service outcomes to improve and then the patient outcomes to also improve. And so what I have in the red circle here is really the focus of implementation research. So it's supporting the implementation of existing interventions and evidence-based interventions and examining the outcomes in which they can target. So I first wanted just to provide a definition of what implementation outcomes are. And so they are the effects of deliberate and purposive actions to implement new treatments, practices, and services. And implementation outcomes really are one of the most critical factors in implementation science because they really define what we seek to explain in research and what we're trying to improve in practice. And overall, implementation outcomes serve as I mentioned, necessary preconditions for there to be changes in our clinical, service, or other health-related outcomes. And the implementation outcomes generally have three important functions. So they can serve as indicators of implementation success. They can also be proximal indicators for the implementation process, and they can be intermediate outcomes in relation to service, system, or clinical outcomes in effectiveness research. And distinguishing between implementation outcomes and treatment or service or other patient outcomes is critical when examining interventions in a new setting. And many interventions fail when they go from a research setting into a community setting or some other type of real world setting. And there are estimates about failure happening about 2/3 of the time when an intervention makes this transition. And a key aspect is to really understand why an intervention may be failing when it's introduced into a new setting. And so focusing on implementation outcomes can help us determine whether it is the intervention that may not be working in the new setting, or perhaps whether it's the implementation of that intervention in the new setting. So it can help us identify whether it's an intervention failure or perhaps a dissemination or implementation failure. And so Enola, Proctor, and colleagues have created a working taxonomy of implementation outcomes, which is shared in the article pictured in this slide. And this article is a great resource for better understanding implementation outcomes. And it is also included in the list of workshop readings. So you should have access to this article. And like I said, this is a key resource when thinking through implementation outcomes. So I was going to give you more information from it. And from the taxonomy, it identifies 8 conceptually distinct implementation outcomes. So that's what you can see here on the screen. And these outcomes, like I said, precede service and client outcomes. So this is consistent with what I showed in the conceptual model for implementation research. Note that not all implementation outcomes are on the list, as you may have some that may be more specific to your context and setting. But these outcomes are typically relevant across disciplines, across settings, and they're commonly what we focus our implementation research studies on. And so this is a taxonomy that is presented in the Proctor article, and I realize the font is small, so I don't worry about trying to read everything on the table at this stage. But what I wanted to draw your attention to is what's included on the list. So across the side here are the different respective implementation outcomes. And then across the top, Proctor and colleagues identified the level of analysis for each respective outcome. And so this is really important to inform decisions about study designs and analysis plans. They also provide the theoretical link. So this provides a theoretical basis for the outcome, and it allows us to help link our outcomes to existing theories, which again is a really important part of the research. There's also a column for other terms in the literature for each outcome. So something that you'll find when going through existing implementation research is that terminology is a big challenge. And so sometimes there are interchanging terms or people using the same term but actually mean different things. And so this provides a link to some of the other terminology out there so you can get a better sense of whether you've seen an outcome before and how it may be distinct from other outcomes. They also provide some guidance about the salience of each outcome by implementation stage. And I'm going to talk more about this in a following slide, but the idea is that some outcomes may be more relevant to projects that are early in the implementation process. So if you're introducing a new intervention or innovation in a new setting, whereas other outcomes may be more relevant if you're further along in the process. So if an intervention or practice has been in a setting for some time, then it may make more sense to focus on how that intervention is being sustained. And then last, they provide information about measurement. So the outcomes can be measured in different ways, and some of them lend themselves to various forms of measurement. So overall, this is a great resource to better understand different aspects of implementation outcomes and what you would need to consider while in the process of planning a research study. And then these are the definitions of the 8 outcomes that are highlighted. I'm not going to read through each definition, but I just wanted to provide some higher level explanations of things. So Proctor and colleagues work to use definitions that are consistent, as consistent as possible with existing definitions in the literature. And they also wanted to establish clear distinctions between related outcomes and constructs. So just to give you an example, you can see outcomes like acceptability and appropriateness. They sound similar, but there are some differences. And there are some overlapping aspects, and sometimes people incorrectly would view these as similar constructs, and so they try to define them in ways where they could be differentiated in the field. And I would say it's rare that an intervention would be acceptable and not appropriate. So there is some overlap in relation between the constructs, but they did try to clarify the distinctions. Another comment about the general definitions, I would say fidelity. It has been measured most often, and it's a very common outcome in implementation research studies. And typically, fidelity is comparing the degree to which an intervention is implemented as it should be as it's prescribed. And it can be measured in different ways, such as adherence to a protocol, the dose or amount delivered, the quality of delivery. I just highlight it because it's certainly a key outcome in implementation research. And then one last point, and this relates a little bit more to measurement, but many of the outcomes can be inferred or measured in terms of expressed attitudes, opinions, or intentions. So these are more latent in nature, and some of the other outcomes can be measured more directly through observation. So that's like the adoption of an innovation or tracking the costs of intervention. So that's another important thing to keep in mind. And again, I'll talk a little bit more about measurement a little bit later on in the presentation. So the next thing I wanted to transition to was discussing the role of implementation outcomes in research studies. And so one of the key aspects of implementation research is that we focus our work on implementation outcomes. And this certainly has implications for the types of studies that we conduct. So I think many of you are probably well aware of the efficacy and effectiveness studies where we may be testing an intervention or therapeutic approach, as you see in the example here, in a research setting or in more diverse real-world settings. And for implementation studies, we focus on implementation process or the implementation process of an intervention. So here we may focus on whether provider training or consultation, which we would consider those implementation strategies, can improve the implementation of an intervention. And as Dr. Fernandez alluded to before, more recently there's been shift to conduct implementation research in combination with effectiveness studies. And that's through the use of hybrid designs. And overall, I think a key point in thinking through the different studies is making sure you have a good organization understanding of the outcomes in which you're targeting with the work. So in the efficacy and effectiveness studies, they are likely more focused on patient outcomes, whereas the implementation would be focused on implementation outcomes. In the hybrid, there may be a mix of both implementation and effectiveness outcomes included in the work. And another key thing to think about when thinking through outcomes in the context of studies is the phase of dissemination and implementation. So as we move from efficacy and effectiveness studies to our D&I studies, we really focus on fundamentally different research questions. And then within the set of D&I studies, the outcomes are likely to be different depending on the focus or phase of the work. So just to give you an example, feasibility, which is a common outcome and is defined as the extent to which an intervention can be used within a setting, may be most important when an organization is trying to introduce a new intervention. However, later on in the implementation process, it may be a moot point. So, and this is because once the intervention has become more part of a routine, really the question isn't about feasibility. However, if you're taking that intervention into a new setting or making certain types of changes to it, then feasibility may be an outcome that, again, is important. So it really depends on the phase of the work and in terms of choosing which outcomes may be most appropriate for some of the specific study goals and study questions. Dr. Fernandez showed a similar slide, but I just wanted to further compare some of the difference between efficacy and effectiveness work and implementation work. So first, focusing on efficacy and effectiveness, usually we're focusing on these clinical interventions and we're using clinical outcomes. And this changes the unit of analysis. It's often at the patient level where we're typically collecting quantitative data and again, focusing on the health outcomes. Whereas in the implementation work, we're focusing our studies more on implementation strategies and how they're impacting implementation. So we manipulate at the implementation strategy level and maybe randomizing based on which organization would be receiving an implementation strategy. So here the focus would be on the implementation outcomes that I previously shared. And then from a unit of analysis, usually we're focusing more on a provider or organization level. So as you'd expect, implementation work is inherently multi-level, and so when we're thinking about bringing new programs in, we might be thinking about specific positions within an organization or how the organization is implementing a program or practice altogether. So the data collection approaches are often use mixed methods, as Dr. Fernandez alluded to before, and we're focusing more again on the uptake of the intervention and the associated processes. So there are some pitfalls in terms of thinking through outcomes as they relate to implementation research. So one of those is skipping over implementation outcomes altogether. So sometimes it's easy to stay focused on just the patient or the individual level outcomes. Another issue is including too many implementation outcomes. So as you saw, there is a list of 8 common, and then some that might be more context specific. But that doesn't mean that you try and include all of the outcomes in some type of research plan. So you have to be really selective and make sure that you're choosing appropriate ones. Another issue is related to measurement, and I'm going to talk more about that in the following slides. And then another thing to keep in mind is the unit of analysis. And again, I mentioned this in that you want to make sure that the outcome and the measurement plan aligns with the unit that it should be analyzed on. So these are just some helpful tips for investigators. So I won't go through these point by point for the sake of time. But I think generally you want to be able to justify your outcomes. They should be reflected in your aims and connected to a conceptual framework. And then, of course, we want to use the best measures as possible to assess them in our studies. And so for the remainder of the time, I wanted to focus a little bit more on measuring implementation outcomes. So this is likely a review for people, but typically what we look for in good measures, and this pertains to implementation outcomes as well, is a reliable measure, a valid measure, and one that's practical. So we want our measures to be consistent, we want them to be accurate, and we also want them to be useful and easy to use. And so there's been a lot of work done recently in further understanding our measures for implementation outcomes. And some of the more recent work's been led by Carol Lewis and her team. And so these are some of the studies that they've published, and they're great resources for you all that you can look through. But in 2015, their team completed a systematic review of implementation outcomes, and their work indicated that there were several measurement gaps in the field. And so they've been continuing this work, and they conducted another review to really identify and evaluate the psychometric properties of the existing measures for implementation outcomes. And when I'm referring to psychometric properties, I'm just referring to the measures' accuracy, consistency, so their validity and reliability. And I wanted to highlight one of their more recent studies, just present some of the implications and the higher level findings here. But this study was a 3-phase study where they first did a data collection phase, which consisted of searching databases for existing measures related to implementation outcomes. And then they used a rating system to assess the quality of all the existing measures that they found in the data collection phase. And then the analysis phase, they just compared the scores across the criteria that they used for each measure within each respective outcome category. And there's some overarching themes that we can take from this work that I think are really important to consider for research studies. So one is just looking at the distribution of the number of measures for each respective outcome. So I think it's important to note here that some of the outcomes had a lot of measures that have been developed, and some have had fewer measures developed. So this can inform the access to what type of measures you may consider in your research studies. I also wanted to share how they compared specific measures for specific implementation outcomes. So again, you don't have to worry about the fine print on the slide itself, but this gives you an idea that the measures are listed here. These are all different measures and that have been studied. And then the bar chart just shows the rating based on the rating scale. And they're color coded so you can see the different aspects of measures that they rated. And so you can see there's variation within each outcome in terms of the quality of measure that they found. So broadly, this presents some measurement challenges. So as you saw, measures are poorly distributed. So some constructs have a lot of measures, some have fewer. And there's a lot of variation within the quality of measures. So many of the measures have unknown or questionable quality as they haven't all been adequately tested. Another issue, and I brought it up before, is, and it was highlighted in this study, that there were a lot of problems with terminology. So specifically, we have synonymy, homonymy, and instability. So this is where different terms have been used, but they really meant the same thing. And then we have issues where we have the same term, but it's used in different ways. And then we have shifting terms over time. They also found that a lot of the measures weren't practical. And then I wanted to also highlight that translating self-report measures can also be very difficult and introduce some additional challenges. So this isn't necessarily something that they highlighted, but I think this is something really important to think through when conducting work in different countries and perhaps using some of the existing measures that have been developed in other countries. And so I just wanted to end by sharing some existing resources for measurement. And these links here are generally good resources. That they don't just provide measures to existing implementation outcomes. They provide measures that can be relevant to contextual factors in addition to implementation outcomes. And overall, I think given the many challenges related to trying to assess implementation outcomes, I think it's really important to be aware of some of the limitations in our current measures. So what this means is that in your research, you may not want to rely on one single form of measurement if it's really a primary outcome that you want to examine. I also think from a research standpoint, the need for improved measurement opens up some research opportunities in this space. And so this can be an opportunity to expand work and really improve the foundation for further implementation science work. So that's all I have to present for today. So I don't know if there are any questions, Amanda.
Yes, thank you, Dr. Walker. There are a handful of questions. So can the community also be a unit of analysis?
Yeah, the challenge with the unit is that when you're thinking at a community level, it's really at a very high level. And so it might be difficult to compare different communities. And so when a lot of times when I'm thinking through some of those higher levels, some more describing what's happening because you can't necessarily compare directly. So, but ultimately it does depend on the scope of the study. And if you have multiple communities, then absolutely that's something you can compare. And if you're just working within one community, I do think it's important to track some of the outcomes at that level.
And so on that same line of thought around the unit of analysis and implementation research, is it typically always the provider and organization, but not the patient, such as patient satisfaction? Could patient satisfaction be the unit of analysis?
Well, again, it depends on. Yeah, I think it depends on some of the focus of the work. So I do think that the intervention acceptability is a key outcome. And I do think that something that's well implemented may impact acceptability at that patient level. But in thinking through your research, you would want to think through the various aspects of acceptability. So I do think it can be appropriate to track that, but you also may want to consider acceptability at the different levels. And again, I think the most important thing is to organize the different people within the organization, and then the different outcomes which may be targeted.
Let's jump into, does a follow-up study of nutritional intervention in a community trial setting qualify to be an implementation research?
Sorry, can you repeat that?
So does a follow-up study on nutritional intervention in a community trial setting qualify to be implementation research? So it seems like maybe they did a nutritional intervention and then they want to see if they could do a follow-up to make it implementation research.
Yeah, so Maria, I don't know if you want to jump in here, but it seems like this would be transitioning up or through the pipeline, so to speak. So if you're taking this into more of a real world setting, but your focus is still on the effectiveness of the intervention itself, that to me would be more effectiveness. But if you could potentially do a hybrid type approach where you'd be tracking the effectiveness of the intervention and then perhaps also some implementation outcomes. And if that's what the study is about, then yeah, I would put that in implementation research. And the hybrid designs allow you to prioritize different aspects. So as Maria mentioned before, if you have emerging evidence about the intervention itself and you want to track implementation, you can do that with a hybrid design. But if you're really building the evidence base around the interventions, then that probably falls more into the category of effectiveness work.
Thank you, Dr.
Walker. I respond similarly, Tim, I think it could classify as implementation research, particularly if you're asking implementation questions, right? So if you're simply doing another effectiveness study and you're trying to find out the impact of the nutrition intervention on nutrition outcomes, on behavior, or on health outcomes, then that's probably more still just another effectiveness study. But if you have specific implementation questions, like what strategies work best to get this program adopted and implemented in the community, what is the feasibility in a particular context or population or setting, what factors influence the adoption and implementation of this program, then you're talking more about an implementation research study, or as Tim mentioned, a hybrid study if you're also going to look at effectiveness.
I think the last question that's come up that we'll have for today is how to minimize measurement error in implementation research outcomes.
Yes, I don't necessarily know that there's an easy answer to this. I think you want to use the highest quality measures that you can use, measures that have been well tested and have evidence of good psychometric properties. And that's where I was trying to share out information from that more recent research study that was really trying to get a better sense of the measures that have been developed for respective outcomes. I think another issue that you want to try and avoid is to use the homegrown measures, as you really don't have a sense of the quality of the measure. And so there's always a challenge of making sure that the measures are relevant to your context, but also have the appropriate testing. And so I think that's a really key feature, is to understand the measures that you have access to, and then to also think more broadly about different ways to measure your outcomes, and not necessarily to be dependent on one single form of measurement.
Well, thank you, Dr. Walker. Dr. Fernandez, do you want to close us out for today?
Yes, thank you. Thank you, Tim. Thank you, Amanda. Thank you everyone for your participation today. I know it's been a whirlwind of activity and information. We greatly appreciate your attention, your questions. We'll be looking at, we're capturing the chat, and we realize that we may have missed a few questions, but we'll be capturing those and we'll try to address them tomorrow. We're also going to be slightly adjusting tomorrow's schedule. We want to keep the lectures at exactly the same times, but we might adjust our breakout sessions somewhat. So that's all for today. Thank you again, everyone, and we hope to see you again tomorrow.
Thank you so much.